Healthcare industry as such, we know that the data explosion is happening, and healthcare industry is one of the biggest contributor of data explosion. We are talking about petabytes and petabytes of data being generated every day. As you would imagine, with so much of data which is humanly impossible to manage, there are equally maximum amount of AI applications being developed around and used in the healthcare industry as well. But it also has the biggest attack surface for a lot of cyber attacks as well. So given these combinations, we want to talk to you about how Dell Technologies can help you in all of these different areas. My name is Sukumar Umapati. I'm part of Dell Technologies. I am a CTO with healthcare vertical, and I lead the healthcare practice for Asia Pacific and Japan. In today's session, what we're going to talk about is how healthcare providers like you can leverage technology and innovative solutions to address the needs of the new requirements of the patients. Everybody today wears a smartwatch, and smartphones give instant visibility into what people are doing. So patients' expectations is changing with every technology improvements that are happening. As a healthcare provider, you should be looking at innovative solutions to change the way you interact with patients and give them a better experience. In today's discussion, I'm going to talk about a few technology solutions that are available and trending in the industry today that you can leverage to make it better for the patients. In terms of some of the key areas in which the industry is moving towards, the digital part of it is extremely important. The digital transformation can be a boon to your organization, and it starts with transforming the healthcare IT first and focusing more and more towards a patient first and a data anywhere kind of a focus area. What it helps you do is ensure that the patient's data is available wherever they are, whenever they want to access it, and it is patient centric. In terms of leveraging new technologies like, for example, AI, 5G, right, or any sort of edge capabilities that are available today, help you make it closer for the patient's requirements and address their needs in a much easier way. The old normal of paper-based and a lot of mundane tasks that happen need to be automated and made sure that repetitive tasks can be automated. That way you are reducing the burnout of your staff, at the same time reducing time and the effort required to service your patients. I'll give you a glimpse of some of the trends that we are seeing in the industry in terms of technology. Connectivity is one key factor that we are seeing today as an enabler for ensuring the scalability of the healthcare service that you are offering. 5G and 4G to an extent has been helping the healthcare providers do many things, right from remote patient monitoring to connected ambulances and ICUs which could be remotely there, and you are able to even service your patients who are very far from the metros and give you a much better reach around. With healthcare data being one of the most sought after from hackers and any sort of malwares, etc., security becomes extremely important. We don't need another tool, right? We are looking at using security which is inbuilt and ensuring that security is built within every product and solution that you are using. Digital twin technology, not only in other areas like manufacturing, but even in healthcare, helps you drive important aspects. For example, being able to do precision medicine as well as giving much faster access to vaccine, etc., in the technology-enabled world today. Another area what we are seeing today is how systems and humans can interact well. Cognitive AI is an overlap of AI and the cognitive computing part of it, which is helping in terms of reduced staff and everything within the healthcare provider like you, but using technology to be able to address many of those areas. Quantum, we also know, is the most disruptive technology that we are awaiting to happen. It is already in use in a lot of places, but quantum is going to change a lot of things that we are aware of in terms of being able to do genomics at a much faster pace, to be able to do any sort of advanced computing that typically happens, which is advanced diagnostics, for example, or even to take care of your secure supply chain part of it. Quantum computing is going to be able to change the way in which you deliver care to your patients. These 5 technologies are not the only ones, but what I want to highlight were these top 5 which are evolving and are being adopted by the healthcare providers across the globe. And we see a lot of, in terms of improvements and in terms of enhancements that are happening are around these fields. What is Dell Technologies doing in all of these things? So Dell Technologies is a renowned technology player in the healthcare space. So we have been working with a lot of healthcare organizations across the globe, and thanks to all of the healthcare customers that have trusted in our world-class technologies, we have been trusted by many healthcare providers to store their data, to process, and even to be able to interact with the patients. We are not alone. We have a huge ecosystem of partners that we come along with. These solutions are pre-done and they are already been created. Reference architectures have been created, and these solutions help healthcare providers like you to focus on the outcomes, and Dell Technologies is able to solve the business requirements that you would have without having to go through the cumbersome process of handling all of those challenges that typically come with adopting new technologies. You could see a glimpse of the total list of partners that we work with, but we have a much larger ecosystem that we work today with. In terms of Dell's focus areas around the healthcare solutions that we work around, our teams have been focused around 4 major pillars, with security being an underlying foundation for all of them. Multi-cloud ecosystem. Multi-cloud is a reality today. We live in a world where cloud is being consumed in whatever way and form. So having a consistent multi-cloud strategy is extremely important. Connected workforce. We are all today talking about connected healthcare. Immaterial of where the patient is, boundaryless connectivity across at home or on the transit or in the hospital. The care needs to be consistently provided, and leveraging connected technologies needs best of breed technology availability, best connectivity availability, and to be able to do things like remote diagnostics and imaging is important for you to be able to scale your care provided. Healthcare edge is an evolving area where we are seeing use of AI and many technologies around AI to be able to provide instant care to your patients at the place where the data is being collected. So there are much more in detail that we will talk about in the upcoming slides. The last but not the least, the precision medicine or the personalized health part of it involves areas around next-gen sequencing, pathology, digital pathology, as well as high-performance computing and research around drug discovery and so many other things. With all of these 4 pillars that we talked about, security becomes extremely critical. So not just about identifying a threat, but also being able to protect it and recovering from such a threat. So we'll talk about that in a bit as well. In terms of consumption models, healthcare providers like you are looking at options. CapEx based one-time purchases are not necessarily the only way to do things. Of course, today public cloud has popularized the thought of paying as you go or consumption based pricing, subscription based pricing. This is not something new to Dell. We have been doing this for a very long time. Apex is our brand of portfolio that we carry that offers as a service model for across the portfolio of Dell Technologies solutions. We'll talk about that in a bit as well. But overall, if you look at how do you ensure data that's coming from anywhere, from a data first access point of view, to be able to using that and deriving more and more insights out of it to deliver better patient care, not just for today, but also for tomorrow. Our solutions around these areas are what we're going to talk about in the next few slides. When you look at a multi-cloud ecosystem, multi-cloud is where we are today. So adoption of cloud to deliver certain services and multiple clouds to deliver different services is prevalent today. But that is not the same as doing a multi-cloud strategy, which is providing you a consistent experience, consistent operation across whatever cloud you are. It's not about a public cloud, it's not about private cloud, it is about a multi-cloud today. We're going to talk about how Dell Alliance's Healthcare Cloud is going to help you envisage this consistent experience and give the healthcare IT the transformation that it needs. Many of the workloads that you use, for example imaging, for example EMR, are available as ready to consume as a service model. We have taken the burden off your hands to be able to design and ensure that we can deliver a per scan cost which could help you deliver the care that you want without having to go through an upfront investment that is required. In terms of the technology that you adopt within the healthcare needs to be not only taking care of your today's needs but also highly scalable, because the needs of the technology and the applications that you would use will evolve and will scale much higher. And how does your healthcare IT today able to cope up with the needs of those that would come up tomorrow? World is in multi-cloud today. About 81% of respondents that we surveyed told us that they are using more than one cloud. So what does this mean to you? You have multiple applications, multiple experiences that you get across different cloud providers. Whether it could be an on-prem, it could be an edge, it could be a public, doesn't matter, right? With all of these multiple clouds that you're consuming, without a proper strategy around multi-cloud, this can be humongously complex and difficult for an healthcare IT. While your focus is around delivering the topmost care for your patients, you will end up consuming more and more resources to make IT work, which is not where you would want to focus as an organization. What does a multi-cloud strategy help you? You look at data first instead of cloud first. So data first approach helps you place the right workload in the right place. Instead of putting everything in one place, you leverage the technology available today and deploy the applications and workloads in the right place without having to worry about an ability to move the workload wherever you want, whenever you would want, and ensuring that you don't have any sort of a data gravity around it. So be it data sovereignty, which could be rules of the law of the land, which ensures that your data doesn't leave the country, or it could be governance in terms of who is accessing, what is it used for, and what sort of controls you have on that, to getting better insights. You need the flexibility to get better insights and visualization. You need control to be able to do data governance. And to be a part of the overall scheme of things, data sovereignty is extremely important. So what does Dell Alliance's Healthcare Cloud look like? So your data is in your control and secure at all point of time. Be it your large data sizes, which could come from solutions like, for example, PACS, sits within your control, within your premises. The larger portion of consolidation, your EMR and other workloads that sit in, will ideally sit within a cloud adjacent world-class architecture which delivers as a service model to you. That way your data is always secure in your hand, and you leverage the benefit of public cloud, which is agility, which is new services and capabilities that are available today. As you know, more and more public cloud service providers are focusing around delivering many capabilities in the AI, in the healthcare space. What does this mean to you is it is going to give you a lot more newer capabilities, innovations around that area. Leverage them, but without risking your data by putting them in the cloud. You are leaving your data within the cloud adjacent data centers, but services of the public cloud are being consumed for doing many of the reporting and, for example, any analytics that you want to do. So what does this help you is, if for example today cloud service provider 1, maybe a Google, is delivering a good service for you on that particular capability, and tomorrow say AWS is able to offer a better service, you are able to switch from one cloud to another and leverage the most cost effective and the best possible technology at the time that you need without really having to move your data at all. And your data, as I mentioned before as well, is within your control in the land and data sovereignty taken care of. At the same time, you will always be able to develop more and more capabilities around this cloud adjacent architecture. In terms of connected workforce solutions, we talked about the need for connected healthcare. Wherever your staff, clinicians are working out of, doesn't matter. They should be able to access and work anywhere, any point of time. So digital healthcare workspace is an area that gives you a seamless experience, be it remote, be it hybrid, be it on your own office, it doesn't matter. The controls, the transparency in usage and management is extremely simple. The end user devices are something that you must be familiar with already. Dell Technologies takes pride in saying that we have created multiple personas of the different users within your healthcare organization, and giving the right tools for them help them do a better job. So that device need to be not only be flexible, but also need to have the control and security that you need so that you are not compromising any of your data. Connected diagnostics and imaging is an evolving field. Today, a lot of healthcare organizations like yourself have multiple branches. You are not always going to have the best radiologist, for example, in every possible location. How do you remotely be able to do diagnosis and help patients even though they are outside in a different branch of hospital? They don't have to take the pain of traveling all the way around to a best radiologist that is sitting in one of your branches. How do you consume all of them? In terms of the personas that we have seen, right from the front desk worker to the clinical support staff to doing people who are working on the data science part of it or any operations part of it, how do you ensure that the right resources, right tools and right applications are available to them with the control and security that you need, ensuring that they can do their job better? So Dell Technologies have been doing this for a very long time. We have enormous amount of different personas ensuring that you can find the right type of configuration and the nodes that are the systems required for the people to be able to do their job better. Healthcare edge solutions I touched upon a little bit earlier. So we are talking about leveraging technologies like analytics and AI right at the place where data is getting created. So edge, the definition of edge, if you look at, is where the physical and the virtual world meet. So it could be your IoT sensors, it could be your modality devices. That is where your data is being generated. So we classify them as far edge, near edge and the core and the cloud, right? So you are able to deliver inferencing and instant insights into your data right at the edge. With the multiverse that we are living in today, we don't want any boundaries. Immaterial of where the data is coming from, be it from a smart watch, be it from a device that is monitoring a patient at the home, or be it within the hospital premises. How do you ensure that the care provided is seamless, is able to take data from every possible area that is coming from and ensure that you are getting better deriving insights out of it? Many a times we know the prescriptions get lost and people are not going to track that, right? So if it is everything is digital, you're going to be able to have, it's a simple thing that you can do is to be able to provide a care across with the insights that the doctor can look at and deliver better patient care. In terms of connected wellness, so there are many ways in which connectivity can help you. We talked about smart ambulances, connected remote patient monitoring can help you in a lot of ways in which they don't have to travel from multiple places to your place of providing care. That way helps you reduce the burden on the patient, at the same time delivering an equal care without really having to travel or go across the locations. Operational optimization is an important factor. What we have looked at is today in an ICU, for example, the staff nurse spends more and more time noting down the vitals of a patient and spends nearly about 20% of their time just about documenting instead of providing better care for the patient. How can we automate that? How can we ensure that the burnout of that staff is not happening and they are able to provide better care? How can we leverage technology to do many of these things that could help them do their job better? At the same time, in terms of tracking, in terms of ensuring that the data captured is getting and deriving better insights to you. Data is everywhere, right from the devices that the patient wear to IoT sensors, it is going to come from everywhere. How do you ensure that you are able to leverage all of that data together? You are able to create sort of a data lake, if not within one place. How do you federate the learning, and how do you ensure that the data that you can get collected in each of those branches of your hospitals, how are you using them to get better dashboards, better clinical trial examples? Right? How do you ensure all of this data movement is extremely secure and help move towards the interoperability part of it as well? In terms of automation, anything that is repeatable needs to be automated. That way, your IT staff as well as the healthcare providers are not going to spend more and more time doing things which can be automated. Leverage technology for doing all of those things. In terms of supply chain, there are many ways in which ensuring for example, a cold chain of the vaccines, etc., need to be taken care of, right from pharmacy, inventory management onwards. How can you do on demand, just in time kind of an delivery of whatever is required? Leverage technology to do all of those things instead of having to stock all of them. Leveraging the edge part of it, I talked about near edge and the far edge. That's where most of the data gets created. How do you instantaneously provide the insights that they need, but the data is also available for doing longer term trend analysis and so many other things which can help you deliver, say for example, NLP, natural language processing, or it could be your computer vision based technologies which can go all the way up to even fall detection in an elderly care situation, or it could be remotely monitoring and managing an ICU for your organization. So technology is available to be able to deliver all of these capabilities without really having to break a sweat. Precision medicine is an area which is evolving. I would say digital twin is one of the such things that happen, which can help you drive the, say for example, during COVID, vaccine identification, vaccine creation was possible in such a short period of time because of the ability to do research in a much faster pace. Next gen sequencing technologies are able to do a complete human genome analysis in less than 24 hours. With the leveraging technology of high performance computing and maybe quantum computing in the future as well, you are able to deliver much lower cost and faster service to your patients. And what does this help you do is to be able to identify and treat diseases with multiple possible options and be able to safeguard the care that is provided for your patients. Today we all know we are living in a digital world, but it is today a limitation, or I would say the way it is happening today is still the slide with the biopsies are being couriered across locations for second opinion, which is not necessarily the only way to do things. A digital pathology can change all of this for you. What happens in a digital pathology? I'm sure all of you are aware. The whole slide image is getting created for your wet biopsies, and that can be easily transported, collaborated with multiple people. High performance computing and research for drug discovery onwards to clinical trials and so many other things can help you deliver better care without you really having to work upon the technology part of it. In terms of a next gen sequencing solution, how does it look like? You have your sequencers that are from multiple providers, and that data gets captured in a storage which is high performance, ability to store that and access that at any point of time, and use that data to be able to process it using high performance computing ensures that you are able to deliver results much faster. Once it is done, you can also archive them so that access to that data is available for you at any point of time later as well without the cost of high performance storage. And the usage of the data and the insights can be across your edge, colo, public, private, wherever you are, because we are talking about connected world. A digital pathology solution today, if you look at from a WSI, the scanners digitize them. From there, the pathologists and the hospital staff use that to tag a metadata and assign a place where it needs to be stored. It gets archived in a digital slide storage, from where it can be accessed, collaborated with multiple other care providers for better insights, integration into your lab information system, and get a patient 360-degree and find new ways of curing cancer, for example. The technology of AI can be leveraged, computer vision can be leveraged to count the number of cells, for example, per inch, which is typically what a pathologist is going to do every time. And we know that about 60% of the time, the work that they do is on a particular set of data that comes in which are normal. How can you leverage technology to reduce the burden on that pathologist by identifying the hotspots or the triaging help that we can deliver? Thereby, the pathologist is not burnt out in terms of what they are doing and be able to focus on where they need more and more time to be spent on. Security is a very, very important factor that we talked about. Healthcare data, as we discussed about, is one of the most sought after and has a lot of possibilities of being attacked as well. So how do you as an organization protect your data? Secure care solution is not a product, it is a strategy. How do you ensure that every product and solution that you are using within your organization has security built inside and ensures that the threats from the outside are being taken care of? We work with healthcare organizations across to not just about processing your data, but also doing threat protection and also the cyber resilience architecture. I'm going to touch upon a bit in the next couple of slides. And how do you identify or detect a threat and how do you respond to it? What you have seen as a typical trend in a cyber attack typically is the ransomware typically sits inside your organization for multiple days, on an average about 100 days. It gets in, it understands the data flow, it understands the solutions that are being, the softwares that are being used, the vulnerabilities across, and it starts corrupting or encrypting or locking the data slowly, right? And once you start realizing an attack is happening, that's by the time a lot of work has already happened by the ransomware. So how do you, as this is an NIST framework that I'm talking about here, first identify such a threat is happening, right? When it is happening, how do you protect it? How do you ensure that data is not being compromised? How do you detect such an activity is being happening, and how do you stop that proceeding further? And if it has happened, how do you respond to it? How do you come back to business? That is the recovery part of it. So our recommendation or the recommended solution for a cyber resilience architecture, especially for a healthcare organization, is to deploy a air gap solution, which is a vault, which is not just giving you an isolation, but also gives you the intelligence to detect such a thing happening and protect it against any such threats. So from your storage, the data is being copied or rather pulled from the vault at specified intervals, which is then disconnected and stays in an air gap situation throughout the rest of the day. At specific points of the time that is decided by you, the data gets into this vault. This vault is not just a storage, it also has the intelligence to be able to detect any of the signatures that we know that these are the potential areas of target, and be able to alert you and stop the data, incoming data from there. And once we identify such a thing, how do you bring back, for example, if an attack has happened at your data center, how do you bring it back your business from this safe data that you have created? So that's what a cyber recovery architecture, cyber resiliency architecture that you're talking about talks about. So we can, as Dell Technologies, not just provide you portfolio of products, but also help you drive the outcomes. Your focus as a healthcare organization is to provide better care for your patients. How can we as technology providers who understand our technology better, who have a large ecosystem of partners, work with you to not just about modernizing workforce or helping you set up a multi-cloud strategy for you, but also help you in modernizing your application and data, at the same time providing you a cyber resiliency architecture and defining security strategy for your organization. Dell Technologies Consulting can help you in all of these things. With that, I would like to thank your time that you have been able to give to me for this session, and if there are any further questions, feel free to drop us a note and we will have them answered. Thank you so much for your time.